Welcome to the lecture, Introduction to Anatomy and Anatomical Terminology, delivered by Professor Dr. Nilesh Kumar Mitra. This is a recorded lecture. As you continue to learn by hearing slide after slide, it is recommended that you pause and go through the slides again by going back and forth to fully understand the concepts. Towards the end, you will see some MCQ questions. You should answer the questions to ensure that you have completed the learning outcomes. At the end of this topic, you should be able to explain the normal anatomical position of the human body and the anatomical planes of the human body, identify the terms used to name the body regions, positions, and the systems of the human body, describe the subdivisions of anatomy, levels of structural organizations and organ systems of the human body. Anatomy and physiology. The word anatomy came from the Greek term anatome, which meant cutting up. The word physiology signifies a branch of biological science that deals with the functions of organs and organ systems. The picture shows anatomy lessons being delivered through demonstration on a human cadaver by Dr. Nicholas Tulp, and it was drawn by Rembrandt in 18th century. Human anatomy is defined as the study of the structure of the human body from the microscopic to macroscopic. Positions of the human body. Hi students, do you think standing, sitting or lying down are body positions? Not correct. As shown in the picture on the right, the supine position indicates lying down with the face upwards. As shown in the picture on the right, the prone position indicates lying down with the face downwards. Lateral recumbent position. Lying on one side, on right side, right lateral recumbent. Lying on one side, on the left side, left lateral recumbent. In this slide, we will understand anterior, posterior, medial, lateral. Picture on left, the girl is in normal anatomical position looking forward, and her hands are on each side of her body. In the picture on the right, the boy is standing, while looking towards the right. In both pictures, the chest is anterior, and the trunk is posterior, and the shoulder is also posterior. Nose is midline. Forehead is also in midline, and navel or umbilicus in abdominal wall is also in midline. Nose, forehead and navel, all three are anterior. Although nose is in midline when we compare positions of nose and ear, nose is medial to the ear, and ear is lateral to the nose. If we compare thumb and little finger over both hands, thumb is lateral and little finger is medial. Middle finger is in midline of the hand. Skull is cranial in relation to the foot is caudal. In relation to the abdomen or belly, the thorax or chest is cranial, and the abdomen is caudal. About the joints of upper limb, shoulder is proximal to the axis or midline plane of the body. Wrist is distal to the axis of the body. In joints of lower limb, hip joint is proximal, and ankle near the foot is distal. Normal anatomical position of the human body. Normal anatomical position is used to describe the normal locations of limbs, body parts, and organs in the human body. Body upright with face, chest and abdomen facing forward. Upper limb, arm and hand, by the side of the body. Palm of hand facing forwards. DORSUM, or back of hand facing backwards. Feet together, with toes facing forwards.